Welcome back to another episode here on the Hart and Hustle podcast. And today we got two special guests from the NCH Health Systems. If you guys can go ahead, Paul, we'll start off with you, man. You're the big head of the table. If you can kind of introduce us, and then who is this wonderful, beautiful woman that you said possibly looks a little better? No, she looks a lot better than you tonight, Paul, and it's a nice fusion outfit.
Good morning. I'm Paul Hiltz. I'm the president and CEO here at NCH in Naples, Florida. And I'm here with Kara Down, who's one of my right-hand people here. Kara and I work very closely together. Kara runs all of our volunteer services and is very much involved in crafting a culture here that's the key to our future, having a kind of culture that thrives on excellence and thrives on creating an environment where doctors, nurses, and other caregivers actually enjoy taking care of people. So Kara, welcome.
Thank you. Thanks for having us, Efrain.
Kara, I thank you guys for taking your time to do this. I know you guys could be doing so many other things like helping people do what they do best. You guys took this time to just have this conversation, really to enlighten people. And I would love to start there when you talk about building that culture. Paul, just before we got on, we talked about some of the restaurants that have been scaling. And that's some of the things, especially when we talk about Raising Cane's. His thing is about culture. Like he literally got a co-CEO so he can go and focus more about culture, and that co-CEO can focus about growth. And I thought that was very interesting, and that you mentioned that, Kira. Like, why is that the space that you go into? Like, why do you know that it makes sense for culture to be built within a location to really scale?
I mean, we did a similar model here. We have COOs at each of our locations just to create that culture, and that way they're focused on that location rather than having to be worried about the entire system. It lets them really know and be available for their team, for their executives, for their direct reports. It lets them have, be part of the pulse of that campus. It lets them, be accessible to a smaller group of people. We have over 5,000 employees, and if you think about one COO for that many employees, if you divest and really make them in that local environment, it just allows them to be closer connected to those bodies, which creates, a culture of listening, communication, collaboration, and excellence.
And where did you learn that from, Kira? Where do you, just through your grind and probably different locations, realizing culture really matters, or where did it all come from?
I think Paul has a mentality to lead by listening, and I think when you have a leadership style that's like that, it's really hard to listen to 5,000 people. So if you shrink the gap and put someone in a tighter environment where they have less people to listen to and more people to learn from, it only can work to benefit our culture holistically. The other thing that's really unique is that each of our campuses have a very different feel. So our downtown campus feels very different than our north campus. And so the people that we are placing there, they might need a different leader, and they're going to have different things that rise to the top in terms of concerns and opportunities and challenges, and then solutions.
I love it. And Paul, what does a good leader mean to you, man? We've seen bad leaders, we've seen good leaders. Clearly, Paul, you're a good leader. Your right-hand man's just kind of mentioned that. Right-hand woman is mentioning that. So what does that look like for you? Why does that matter?
To me, a good leader is somebody that really can see the potential in a person and help match up that potential with an opportunity. And we try to do that here. One of the things, Efrain, is that if you look across the country, the American Medical Association says that physician burnout is a crisis in American healthcare. So doctors are really burning out. Nurses generally have very high turnover right now. We're trying to reverse all of that. So just this morning, a perfect example, Kara and I, we have a leadership academy with 20 individuals in the academy. Today's the sixth session, so the last session for this year. We do it 6 months in a row, and we really try to put a spotlight on mid-level managers to understand what their strengths are, what the potential is, and to elevate their profile so that we can promote them the next time an opportunity comes up. So to me, going back to your question, the leaders are the ones that can identify people that have the potential to go and make a meaningful contribution to an organization like NCH.
I love that. Paul, how long have you been CEO and president?
I've been 6 years CEO here. I've been a CEO in various healthcare organizations for the past 20 years, if you could believe that. So it's been a lot of fun.
I went to go take a little bit of water, and then I realized I had to put my fingers over the title. It says Advent Health on it. I'm like, we're not promoting these people here today. You know what I mean? Like, we got something else to promote. I'm almost scared to drink water now.
Yeah.
I know. I need that cup so we can just start promoting you guys. No, I love it, Paul. So you've been doing this for 20 years. What gets you into the space? What gets you into the space of healthcare, giving back? I feel like these spaces of the nonprofit and healthcare, these are very impactful places that people don't really touch a lot. And if they do kind of get into it, they forget why they do it, right? They forget the purpose and passion behind it. It's not all about the paychecks, but what got you into this space, Paul?
Well, it's interesting you asked what got me into it. Was when I was a little kid, my aunt was a hospital administrator in Cincinnati, Ohio, and she used to take me through the hospital. And the thing that really got me hooked was seeing the kind of the diversity of people from all over the country, from actually all over the world, foreign people of all different colors and shapes and sizes and backgrounds. But they came together as a team to take care of people at Good Samaritan Hospital in Cincinnati, and that got me hooked. I always thought, what a great idea to get the smartest people from all over the place, put them on a team, and their main concern is to save lives and help people get better. And I've never lost the enthusiasm for it, even today. We do that here, and teamwork is a key thing here at healthcare. And we promote it, we highlight it, and we look for teammates and team players that have that same passion.
So, Kira, in your space of healthcare, how many years have you been doing this, and what brings you to the table of healthcare?
I actually started my career in healthcare at a for-profit system in Nashville, Tennessee called HCA, and they own about 181 for-profit hospitals across the United States. And, just really, I've always been that way since I was a kid, where I just want to help people and find solutions. And so that was kind of how I I married those two passions together. I went and did a lot of other things in various industries after that, which I think has helped bring me into a different kind of perspective as I came back into healthcare about 5 years ago here at NCH. And I think kind of having that beginning and end journey, has really helped to shape and formulate some of the things I'm passionate about. And then just being a part of other industries that don't have that care, concern, compassion, and empathy for others, it's difficult. And so when you get to go back into a space like that and live through your authentic self, there's just something about it that allows you to live more fully.
Authentic self. I've been saying this so often because I can imagine that you guys know people, leaders that are not their authentic self and put on a mask, and it's like, it's bothersome at sometimes. Like I can see it. I can see right through it. How important, Paul, is it to be your authentic self as a leader, especially as big as this organization is?
I think it's critically important because, as you said, you really can't fake it. And in these days, especially the younger workers are really looking for meaning in their work as much as paid benefits and anything else. And I believe that the young people are really looking for that authenticity, something that they can get into and believe in. Yeah. Because especially in the healthcare world across the United States and really across the globe, people have lost trust in the big established organizations like the CDC, HHS, all the vaccination controversy. So at least at the local level, at least where we are here at NCH, we try to promote this idea of transparency and trust and authenticity. And I think it's going to attract young people into this profession, this organization. So we're excited about that.
I agree. I think another thing that will really attract people is for them to be able to do more of what they love and less of the things that they hate, right? So I say that in the sense of AI. I think that is such a crucial space of where healthcare is going right now. A lot of people are being early adapters. Are you guys in the space of actually seeing AI, and how is that working out for you guys in the space that you guys are using it?
We are we consider ourselves early adopters of AI. One of we've got multiple areas, but one that's kind of exciting to me, you just mentioned it, how do we help people do less of what they don't like? In healthcare, clinicians don't like documentation. They like to be taking care of patients, not writing in a chart or typing into a computer. The AI that we're piloting right now is something called DAX, which allows the doctors and nurses to speak to a patient, and this AI application just takes the relevant clinical information out of that conversation, puts it right into the medical record. It eliminates that idea of doctors turning from the patient and typing. And we think that's just one instance that's really going to help people enjoy their work a lot more.
Kira started laughing and smiling a little bit. I can only imagine she has something to add here. Kira, are you fascinated about this space? Are you excited about what's going on in the AI space?
I love it, actually. I think it's one of those key things that provides lift to those doctors. Paul mentioned burnout being a huge factor with our clinicians today. And so if we can make this tiny thing work for them and, able to kind of collaborate together, and all they're having to do is really check and make sure AI got it right. Gosh, can you imagine how much more time they get with their patients, and much more time they get back to themselves to be able to kind of pull into that wellness and stay healthier and happier, and longer in their job and in their life.
I love it. Yeah, I think we're definitely in a space where there's so much potential. Obviously, you have to be very mindful of what's out there because everyone's in this space and you don't know who's the real one and who's not at this point, right? We talked about being authentic. And I love it. I think that when you talk about as well as going into your doctor and having that conversation, and I say this all the time, I speak to someone in healthcare because it was just so, I didn't notice it until now when I'm 30-some years old, on how bad it is that you go and for experience, and your experience, you don't even know what this person looks like face to face, right? Because they're not looking at you, nor do they know what you look like. So I walked into one of my yearly appointments, right? And I went in there, and my wife is the one that set it up for me because that's what wives do, right? Shout out to all the ladies that do all the men work. Paul, has someone set up your appointments too, Paul?
Of course.
Right? That's it. No, so my wife, she says, yeah, it's my doctor. I go in there. I'm a very talkative person, so I'm talking to the lady like, yeah, you just took care of my wife the other day. And she's like, yeah. Then I go and I tell my wife about the experience I had. And she's like, that's not my doctor. I'm like, so the lady just sat here and lied to me, all just to kind of get through whatever she was doing the whole time, just looking, never looked at me. I'm just sitting there just talking. And it's the experience. It's like when we go to a restaurant. It's like when we go to an amusement park. We pay really for the experience. And when people don't get that good experience, it is so hard for them to come back. When they don't, as you mentioned, trust a little bit. When you mentioned being authentic, like those are the things that allow people to feel comfortable and wanting to come back and realize that you actually cared. And I think now more than ever, we are looking for people that care. So you guys doing what you're doing is really going to continue to, uplift what you guys are doing. But Naples,
Two quick things on that, and I love what you just said. The two quick examples. We have a simulation center here where we actually train people on how to do the eye contact, the physical touch, and that way doctors and nurses can get video feedback on how they look when they're interacting with a patient. That's been one thing that's really helped. A second thing that we were just talking about, Kara and I, before we got on with you, we just recently hired a hotel executive who's been 15 years in the hospitality industry. He just joined our team from a national hotel chain to help us learn hospitality. We know customer service, we know patient care, but the things that happen in a hotel to make you feel welcomed and cared for, we want to bring that same feeling into the hospital to the extent that we can. And a third thing that Kara is working on is a big initiative to expand our volunteer program here so that we have volunteer ambassadors from the community to come in here and really add to the culture and expand that feeling throughout this whole Southwest Florida community. So that topic you just brought up is something very near and dear to our hearts, something we're going to spend a lot of time on to make people feel heard, cared about, listened to, and we'll continue to work on that in this year ahead.
And I think just to piggyback on that really quick is that, in bringing in a hotel executive to come into a hospital room, they may not know all the ins and outs, right? But they're able to, what they do know is the human experience. And so as we think about patients, their guests, their families, their kids, our team, it's about enhancing the human experience regardless of who you are within these walls and making sure it's just the best it can possibly be at every touch point possible, not just from your bill to your bill, but from the time you are greeted to the time you have to make a follow-up appointment and everything in between.
Hey, real quick, if you're enjoying the podcast, we first want to say thank you. And we also just want to give you a little insight of what we're up to at Francis. Some don't even realize that we're working with organizations to help them use AI to create that real human communication experiences, whether that's actually supporting your families, those patients, or the entire community. We're actually creating tech that connects. Check it out, francis.ai. Very good. I don't know how you guys ended up thinking hospitality manager or someone in that space, but it's so smart. And I'll tell you why. Because I think hospitality, especially when done well, they win time and time again. Recently, I was going to Boston, and the first time I went to Boston, I had an opportunity of a lifetime, so I didn't book a hotel. I just had to get to Boston. So when I went there, I stayed at a horrible hotel. Hospitality was horrible. Wouldn't go back. Wouldn't recommend it. However, from that hotel, I had to go drive to conduct an interview in person. And it was just, I think she was a supervisor of like food and beverage or something like that. But she was so kind from the time that I walked in. Everyone, I was only in the lobby and just conducting this interview, but everyone was just so kind. She was so kind. I left there thinking to myself, next time I come back to Boston, I'm staying here. I came to Boston 2 weeks after, and I stayed at that same hotel because of those people. When in reality, down the street, it was a Hyatt. I think it was between Hyatt and Hilton. There was a Hilton down the street, a little less, expensive, but I remembered how I felt and how I was treated, so I went back to that place. And I was so excited because when I went back, they're like, "Oh my God, you're back!" And I was only there for a couple hours. So yes, it matters so much when you can get that. You're always going to choose where that experience and where you felt cared for, and they were just nice to you, right? And it's clean and all the other good stuff. So as you mentioned, we have everything already done. We just want that care, that person to feel like, oh, I want to recommend them. I want to come back next week because I had so much fun. That's really, really good.
We're convinced the same way you are that is the winning formula. And actually, Mace, I say this a lot, but we say this a lot, is that to attract the best doctors to come and practice here, we have to make the doctor feel welcome, because doctors have felt somewhat disenfranchised from the healthcare system. And that's why we've been so focused on keeping ourselves locally owned, locally governed, so that we can deliver first-class interpersonal relationships to physicians, nurses, other technicians. Everybody that comes to work here needs to feel a great relationship, and we're going to continue to emphasize that.
Paul, I see why you're the man to run the team. I mean, I'm pretty sure that's also good people around you, but these ideas that you're saying, it doesn't happen often. I speak to a lot of people in this space, and you're really ahead of the game. I mean, from the hospitality part to the AI part, is there anything else that really separates you guys from the rest of the individuals?
Well, you can talk about, we have a meeting that Kara has organizes quarterly, and we call it Cultivators. And it's our mid-level management, but you might talk about how we do that.
Sure. So it's C2 for short, or Culture Cultivators, and we really wanted it to be a beginning point or a starting point for our culture. One thing we know in healthcare, and I think that it's pretty much across the board nationally, that our frontline staff, they trust their manager, but they don't trust administration. So the gap is really big from administration to someone who's actually giving the care. And so as a way to try to reduce that gap, we created a quarterly meeting with the middle management team. And we have the administration talk to that middle management team. And they share, this is what's happening in my organization. Transparently, this is what we're making and losing as a hospital system. Here's what I'm doing that's making your experience great to be at work. Here's an idea we heard from you that we're implementing because of something that you said. And showing them that we're listening and implementing all those things. And then they're able to take that information from that meeting and tell their frontline staff, guess what? I heard from the CEO today. I heard from his leadership team. They gave me this to give to you. And so they have team huddles and they share that information. And so we've seen that gap shrink tremendously. So much so that year over year, our employee engagement scores grew by 57%. And I know it's not just that meeting, it's all these other things we've been talking about, Efrain. It's, the engagement, it's the leadership academies, it's the president's forum, it's these other opportunities that we're providing But being able to shrink that gap and let middle managers know that we had their back and we're communicating with them truthfully and honestly, and that we're listening to their feedback and incorporating it into what we do every single quarter, it really made a huge, huge difference. And so those meetings now are just, they're places of fun. They're places of engagement. People look forward to them. They feel left out if they can't come and they want to join virtually, even if they're off on PTO. And then as a secondary matter of that, we've created a speaker series as a kind of an off-cycle meeting. And so we'll bring in executives from various industries. We've had executives from aeronautics, from IBM, from Navy SEALs. We've had former shopping executives and sausage manufacturer executives come and talk to this group of healthcare middle managers and directors. But the thing that we really try to get across is, what does it take to be a leader? What does it take to build a great team? What does it take to provide a sustainable culture, to build trust, authenticity, to deal with change in a transformative environment? Because if you've been in the same job for 20 years and something's being done differently, you may not want to do it that way. Yeah. So helping leaders get okay with that, or their team. And so that's been a really fun component that we've added on to. This just created kind of a cross-functional awareness, education, and then just a culture bolster.
This is so good. Like, you guys, this just to hear where you guys are at, it's so different than anybody else that I'm seeing. Paul, were you always in Naples, or did NCH?
No, I spent my whole career really in Ohio. Up until 6 years ago, I was recruited to come here because of a change in leadership. But I was in Cincinnati and up near Dayton and then near Cleveland. And I was happy to come to a warmer climate. So I really enjoyed the sun of Florida, even though I love Ohio, love Ohio State football. But it's fun to be in Florida, where there's a lot of growth and a lot of opportunity. We're having some great innovations here, and the population's growing. It's a great environment for healthcare, I think. And so it's a great place to be. And it's a great time to be in healthcare, too, with so many innovations and so many things we can do for patients that we couldn't do as recently as 10 years ago.
Yeah. You mentioned what does it take for a leader, right? What does it take to be a good leader? What does it take? First of all, I want to go back to the fun part. I have on the board that I sit, one of my board members always says, Efrain, if it's not fun, it's not going to get done, right? So bringing that fun into what you guys are doing allows people to really get engaged, and now it's getting done. The things that you guys want is getting done because you brought fun to it. So I actually love that. I love that you guys start beyond just the C-suite level, right? You guys truly thought about at the bottom line, because you remember what it looked like when we first got started. I say we, I didn't get started. Healthcare, by the way, is not my thing. Want to know why? I'll pass out if I see blood. That's why. Not my thing. Okay, when my wife gave birth, they almost needed 2 doctors in there. One for her, one for me. I almost passed out.
That's great.
What does it take, back to that leader question, what does it take to have a good leader? You guys been in this space for so many years and probably worked with some that may not have been so good, but what does it take?
Well, I'll tell you, when we spend a lot of time interviewing when we have a new teammate, and we look for things like inquisitiveness. Is a person curious? Are they interactive? Do they listen? Because we believe in healthcare, listening to the patients is just so critically important. So we look for people like that. We look for people that come in with a problem-solving mentality, people that can work well in teams, because in healthcare, very difficult to do anything on your own, including the CEO. CEO can do very little. It's really, healthcare, we believe, is a team sport. So you're looking for people that have demonstrated they can work on a team. We look for athletes, because people that have played on high school or collegiate teams is a good background. People that have solved problems, and they don't necessarily have to come from healthcare. They can come from other industries. In fact, we think that's really important right now, to have a diversity of background. So those are the qualities that we look for, and we have an interview process that includes multiple stakeholders here, so that we look at a person from all angles, right, Kara?
Mm-hmm, yeah, and we do try to kind of take them around. It's not just a one-time interview. It's multiple days. It's multiple types of situations and scenarios, just to make sure it's a good fit. Because if you don't fit the culture, you're ultimately not going to be successful, and so then it's our loss and theirs. And so we want it to be, easy from the time they walk in to the time, they get started and feel enmeshed. The other thing I think that's important, while we do try to look at talent from outside our pool, the other thing that Paul's done a really great job at is really promoting a culture of promoting from within. And so, the leadership forum he was talking about, it's called President's Forum of Excellence. It's one avenue to help our team do that. Another one is our Physician Leadership Academy. And while they're not being promoted necessarily, they're growing their skills and they're getting cross-functional teamwork with physicians from other areas within the hospital. And then we do the same thing in our nursing capacity too. We have learning and skills training for them, their first year of nursing all the way through to the time they've been here for 20 years. And so just helping those nurses and those team members really get acclimated to knowing how and what it takes to become that next level leader. We're trying to share that information with them. And we're in the process too, because of this culture, of creating a leadership boot camp. So when you go from being just a frontline leader to all of a sudden now you have to manage a team and all of the downstream impacts that come with that, learning how to manage a budget or, deal with someone that needs FMLA or, manage up for a very difficult personnel issue, or learn how to lead a one-on-one, anything like that, from very simple to a little bit more robust, trying to really equip those leaders so that they feel prepared to step into that leadership role. Not just because they've outgrown the role they're in, but because we're helping them become that next level leader and coach.
Yeah. It's so important to invest into your leaders. Like, I come from various industries, and the one thing that I couldn't stand is people put people in positions and never invest into them. And expect them to get it right, and then when they fail, they look bad. But it's like, what did you do to actually invest? And because I do a lot of coaching, I was actually talking to it was a franchise owner from Firehouse, and one of my friends works there, and he's like, "Hey, Efrain, what can we do to build sales?" He's like, "Our stores are down." I'm like, "Well, what are you doing to help your managers?" Because to me, I always feel it is at the manager level. If you're not leading, if you're not pouring into that leader is not pouring into the people under him, then how are you really growing? Because I've been in this, the sandwich shop or the sub shop industry, and whatever store that I went to was successful. Why? Because I understood how to lead, and I found people that would willing to be a part of my team. Because that matters so much that when you walk away, it's still running like if you're there. And that's the most important part, is pouring into your staff. And I love that. I love that you guys this whole conversation has been, how do we pour into our people that work for us? Because it's not about us. When you're at that level, it's not about you. Okay, it's about everybody else that's doing the actual work that people don't realize. So I totally appreciate that you guys continue to talk about pouring into someone and hiring from within, right? Allowing them to know their value. Okay, we see your value. Now we want you to see your own value, and let's kind of walk through that. This is just amazing. How long have you been working with each other? The whole 5 years, Paul and Kira?
I came about a year and a half after he arrived.
Because I only say that because the way that you guys, we were just talking, Paul said something, and the way that you guys are transition, you can tell you do this often. And I'm like, wait a minute, this is a good duo right here. This is an unstoppable duo.
It's funny you said it often happens. I have an idea that sometimes, we even talk sometimes on the weekends, and Carol will say, I've been thinking about the same idea, and here's my thoughts on that. And then we immediately kind of get to that. So part of that culture that we have is trying to create people that are always sort of thinking about how can we get better. And Kara's a perfect example of that, and just trying to interject innovation ideas into this culture thing. One of the things and again, Kara's doing a lot with volunteers. We really think, Efrain, that one of the next big areas is going to be to dip down into the high schools now and start getting younger and younger people interested in healthcare in either a volunteer capacity or whether we can train high schoolers to take on roles here in the hospital, right, Kara?
So we have a 6-week program in the summer that's specifically for volunteers. And so you can be 15 to 18 and volunteer here for about 6 weeks, and you can do any number of jobs. But I just kind of asked the question, why couldn't they just stay on? As you know, being in Florida, Bright Futures is a great program that requires you to have a certain number of volunteer hours. But also, it's allowed a lot of students in high school to dual enroll, which means they have a lot of flexibility in their day-to-day work life, whereas some other locations in the U.S. don't have that. So my son is a great example. He doesn't have to go to school Monday, Wednesday, or Friday. So he's able to volunteer that entire day somewhere. And so being able to kind of tap those young, bright, energetic minds and get them invested in something and show to them that there's capability, there's growth opportunity, that there's things they can do that aren't a nurse or a PA or a doctor, that they could be a healthcare executive, or be an HR person that knows everything about healthcare. It's been really, really exciting to see every orientation class since this summer. We've had an exceptional number of teens coming in and wanting to work in healthcare, and not only just healthcare, but work at NCH because they know that we're doing something different. So it's been really great, and I'm grateful to the leadership team here to support initiatives like that to help us do things like that.
I love that. I think these are the conversations we should be having in high schools, is having real authentic conversations. And becoming the president of my old high school, it is that. It's talking about the nonprofits. It's talking about doing things that you have passion for, things that are purposeful, right? Because a lot of the times when we're in schools, we're told to really chase the paychecks. And it's like, that's not really what fills my cup, and it doesn't fill a lot of people's cup. You can make all the money in the world and you're still not happy. But what happens when you're doing something that is actually, purposeful, that really fills your cup at night when you go home like, man, I'm so glad that I was able to help this woman or this man overcome whatever the situation was. So no, it definitely does matter. And I love that you guys are in the space of just getting our young ones in here and helping with that work ethic. No shade to them, but the work ethic is a little different. So I can imagine that you guys are pouring the good stuff into them. So if they stay there, great. If they actually spread their wings, that they've actually been taught well as well because of the good leadership. What does it look like, though, volunteering? I think that's really fascinating that you guys mentioned that. If we can kind of talk about what does a day-to-day look like if someone wants to go volunteer for the organization?
Goodness, so we have any number of positions available, from a golf cart driver that takes you to your car after you parked and brings you to the front door, to a greeter that walks you to your admitting appointment, to someone who's managing the surgical waiting room, to being embedded into our floors. So we're getting ready to pilot a program here where we're embedding volunteers into our units to serve as additional support for our nursing teams and to provide access to patients. So if a patient needs a glass of water or needs an extra blanket, that volunteer can go and help provide lift not only to the patient, but to that nursing unit. As you know, in healthcare, if you've been to the hospital or known anyone that has, it's not always an easy time, and there's times when you're bored and you may just want someone to talk to. So can we just make that availability? Can someone just pop in and say, hey, I have a magazine. Is there anything else I can get you? And just to listen, because sometimes they've been here for a couple days and they just need someone to talk to. So just finding ways. I mean, that's the thing that is so great about the leadership, is that we're just going to try it and see what happens. And so if someone has an idea, we're going to say yes. And then if it doesn't work, we'll figure out a way to make it, repurposed into something else. So all kinds of volunteer opportunities available, and I'm always excited and looking for more.
What are some of the values you guys live by? I mean, I always feel that there's values that we live by as an organization. Not only do we say it, we actually live it. What are some of those values you guys have?
Well, you're the podcast, Hart and Hustle, I guess are two, I think, really, we I think, live by this idea. We're passionate about what we do, and we don't sit back and let things happen. We try to be a little bit faster than the average bear, faster than the average organization. So those are clearly two. I think if you're in healthcare these days, you have to have a certain energy level. And, I think the two of us both, we talk about this because we both are fitness people. We like to be fit and keep our energy level up to a point that we can be effective as leaders in a space that's dynamic. And we bring our best selves to this place every day. And we have a team of people around us that do the same thing, I think.
I think one thing that continues to be a theme for us internally and as we talk to our community is quality. So we're really focused on that. You hear that lingo quite a bit if you walk the halls of NCH. And then excellence, doing everything you can with excellence. So almost, I like to say, let's be superlative, not just let's be excellent, let's be better than excellent. Learned that from a dear friend of the hospital, Mr. Ralph Stayer, and he just kind of challenged us, can you be better than excellent? Can you provide better service? So what's that superlative nature look like? And I think in healthcare too, it's underlying themes of compassion and empathy. They're always going to be there, but just making sure we never stray far away from those things, because even though we're hustling really hard, we still have to be compassionate and empathetic, because you just don't have it every day. And so if we're willing to be empathetic and provide compassion on the days we don't have it, it lets the others of us that do have it hustle harder for those that don't.
I love it, Paul. I think you're going to be in trouble when people see this and how good Kira is, and they might try to actually recruit her. So be
That's
very
already
careful.
happening.
I can imagine. I'm just talking to her like, wait a minute, can we duplicate her and add her into other health cares?
There's only one of her. They threw away the mold after they made Kara.
I love it. No, I ask you, Paul, when we talk about other CEOs that are not talking about culture, if you can actually sit across from another CEO in America for just 1 minute, what would you actually say about culture right now?
Culture to me is more important now than it ever has been because, again, going back to this idea that so many people are burned out, number one. The other thing is there's just this lack of trust across the United States, especially with the young people. If they can't find a culture that they feel good about joining and that they trust that, I just don't see how organizations are going to be able to fill the jobs because people are voting with their feet right now. They'll pass up a paycheck if it's just not living in alignment with their values and with the way they want to live. So I believe we're going to double down on trust here, and I believe over time it will be the winning strategy and will make our jobs and our lives just enriched because we'll be living our true values.
Okay. How many locations do you guys have? I think there was one that when I was looking up, you guys have another one maybe opened up in the fall. Has it opened up already?
Yeah, we've got 3 hospitals now, and we have over 200 other locations throughout Southwest Florida with outpatient, physician offices, diagnostic centers, and then we've recently begun talking about a 4th hospital now out in Ave Maria, which is north and east of Naples. So our footprint will expand a little bit here over the next couple of years. We're excited about that.
Was that a goal of yours, Paul, taking the seat?
Yes, not so much expansion for expansion's sake, but we're big believers here is that people want healthcare as close to their home as they can get it. And so when the population begins to shift out to the north and the east, we want to be near people's homes so that they don't have to drive to access healthcare. And we'll try to be in each of the neighborhoods here in Southwest Florida.
All right. Listen, I'll leave you guys with this blind question. This is the last question just to kind of get you guys thinking. You guys made culture your cornerstone, but leadership can be very lonely. What's one moment in the last few years that may have broke you guys, and how do you put yourself back together? I think it's always fascinating to figure that out because we look great on the outside. Okay, you guys mentioned I look great. Sometimes though, on the inside, we're questioning ourselves. The imposter syndrome is running 100 miles per hour. So tell us, if you want to start off with Kira, ladies first.
There's a couple options I could go here, but I think for me, in thinking back over the last few years, Hurricane Ian was probably one of the hardest times for me personally. I had not really ever been through that devastating of a hurricane before, and so to have waters literally at the door of our hospital and not getting in, and to know that we were, able to care for people who had lost their entire homes where they had lived for most of their lives. Just a couple blocks from here, water was 8 feet in people's homes, and so just seeing the vast devastation of both the land and then the people was really, really tough. That was a tough time, but there was a bright spot in that. Again, the water made it to the door but didn't come in, and for me that just was this. It was this bolster that we are here for the community, by the community, and so we're always going to be there no matter what, even if a hurricane waters do get through the door. And so the resilience of this team during that time was really what I think just kept us all going. I know for me personally, and just continue to see that time after time, whether it's a small or a large catastrophe.
Yeah, that's a good one. I appreciate you sharing that. Paul?
And that is a great example. And to me, another one was in the early days of COVID when you just really didn't know, there wasn't enough data. We just had to make the best of a tough situation. And again, listen to our doctors, listen to the experts at Mayo, and do the best we could to reassure the community, reassure our employees, and just not lose focus in those early days of COVID. But that's the challenge of healthcare. That's why we really like healthcare, and we love solving problems and working as a team and making a difference here in Naples and in Southwest Florida. So it's great to share these ideas with you, Efrain. Really is fun to do this.
Yeah, not just share with me though. Share with everyone that's listening. I think there's so much things when we talk about leaders right now. We're in a space where government funding has really shaken everyone's foundation, and everyone's trying to figure out how do we pivot, how do we move forward in these times. And Paul, it doesn't look like you are worried at all. Like the both of you guys are sitting here very comfortable, understanding where you guys are at. And I almost feel like if we can overcome the pandemic, oh, this is nothing to us. It's just kind of the looks you guys got to.
Sometimes, Efrain, yes.
I appreciate you guys so much. What is the website if someone wants to go volunteer, find out more about the hospital?
To find out more about NCH, you can go to www.nchmdmedicaldoctor.org. And just to find volunteers, you would do a /volunteer on that.
Love it. Are you guys on socials? Can I see you guys on socials or anything like that?
Social media, yep. So our Instagram is NCH Florida. We're also on LinkedIn as Naples Comprehensive Health, NCH, and we're on Facebook as the same.
Love it. Well, guys, another amazing conversation with other great leaders into the space of just heart and hustle, of giving back, of understanding what impact looks like in our community, and just never giving up even when times get hard. This is Paul, Kira, I'm Efrain. We'll catch you guys on the next one. Laters.